KPRC2, we are dedicated to telling stories of the people, the groups, the missions happening to build a stronger Houston. And tonight we focus our attention on a group that is helping break down barriers when it comes to delivering information and access to coronavirus vaccines.
And these efforts are for Houston's immigrant community. Our Robert Arnold is live in Southeast Houston now with a story that you'll see all new at 5. Robert?
The immigrant advocacy group FIEL wanted better answers as to why critical health information was not making it to everyone in the immigrant community. So FIEL commissioned this study, which involved knocking on more than 7,000 doors in 4 areas of town. Ana Hernandez owns Doña Maria's restaurant with her husband.
We would always try to keep them updated as an employer and to take care of our employees, telling them that this and this and this.
She's talking about the discussion she had with employees about the COVID-19 vaccine. Some were eager, like head cook Yancy Morales. A lot of people decided no, it was dangerous, but it was always my decision to get it. But Hernandez says other employees were hesitant.
They had really unfounded fears that were not realistic.
Beyond cultural fears, Hernandez says many of her employees simply didn't have access to needed information.
They have no earthly idea how to even turn on a computer.
Realizing many in Houston's immigrant community did not have someone like Hernandez to help them navigate this pandemic, the advocacy group FIEL launched a study. What barriers did you find that you didn't realize existed?
The number one barrier that we found is people accessing information.
FIEL Executive Director Cesar Espinosa says 10 canvassers called promotoras knocked on thousands of doors in 4 parts of town, east, southeast, and northeast. These areas have predominantly Hispanic populations with medium household incomes between $33,000 and $52,000 a year.
There was a lack of access to internet. There was a lack of access to different resources. There was language barriers.
Espinosa said when it comes to technology, many immigrant families only have cell phones, no laptops. At the beginning of the vaccine rollout, many websites were not mobile friendly.
That actually turned out to be a very big challenge for some folks.
Espinosa said other key barriers were transportation and time. He says most in the immigrant community couldn't afford to stay home, and when they lost one job to the pandemic, they would have to get 2 or more part-time jobs to make up the loss, which left little time to think about things like getting vaccinated.
They're still having to make ends meet, but now in a much more complex way.
In the immediate, Espinosa said the study helped city and county leaders understand critical websites need to be more mobile friendly, and there needs to be more neighborhood-based education.
The only way to combat this is, once again, through community knowledge, to explaining to people and to make it easy for people.
Espinosa says this study is now being used as a model on how to get critical health information to the immigrant community during all types of disasters. You can read more of the findings on click2houston.com. Reporting live from Southeast Houston, Robert Arnold, KPRC 2 News.
Robert, thank you.